So what I'm going to do is I'm going to rearrange myself to work around him so that even if his head turns, it only turns a little bit. If I'm really concerned, I might even bolster the other side of his head so it can't turn more than a tiny bit, because I want him to feel safe. So side of my hand is going to rest right along one side of his SCM, other side of my hand, other side of the SCM, and then I'm going to give it a few moments, let our skin start to stick, and then my two hands are going to stretch the skin opposite direction. And one hand might move a little bit more than the other, but in this case my right hand is pulling up towards his ear, my left hand is moving down into the sternal notch.
Does it make a difference which hand goes in which direction?
Most people are going to find that the hand that's between the SCM and the clavicle, usually if that one is the one moving down into the sternal notch, most people will prefer that.
Okay.
But not everyone. Once in a while, if you're not sure, if they're like, it seems helpful. Okay, notice I can't poke at the spot that was tender. Does that feel helpful, what I'm doing right now?
Mm-hmm.
Okay, but let's say I'm not sure. Now I could just pause and then just go repalpate it and then see if you notice the difference. If it's helpful, then I'll go back and do more. The other thing I could do is say, okay, Matt, I'm going to go the other direction here, and I'll just reverse the direction. And I'll pause here. Do you like this one better or the other one better?
This one.
You like this one better? Okay. So I'm going to go with the one he likes better. Okay? And most people, it's going to be one way. If Matt is picking the other way, go with that way. It's about Matt, not about other people. Okay? And so if I could reach in there and poke that spot, that would make it even easier. But in the moment, I'm going to go with what he feels is helpful.